What you just heard is the loud screeching sound of a cranial drill. Kind of sounds like what you would hear at the dentist, right? Now imagine drilling into your skull, even closer to your ears. During awake patient brain surgeries, this is exactly what patients are experiencing. Awake procedures are increasingly utilized by brain surgeons in the neurosurgical field due to the unparalleled real-time functional testing, as well as decreased time spent in the ICU and inpatient care, and decreased mortality rates. However, there is one crucial user in this development currently not considered: the patient. The sound of this drill itself can prove to be excessively intense, and some even report hearing loss or psychological trauma from the event. Sound is conducted both via the air and by bone, so other technologies that simply block the ear canal don't address the current problem at hand. More specifically, we are aiming to intercept the bone-conducted sound on its path to direct stimulation of the cochlea, followed by subsequent action potentials sent along the vestibular cochlear nerve for the perception of sound. Our predicted unit price of $1,000 is similar to existing drill bits, and 400,000 patients undergoing awake cranial procedures in the US annually give us a serviceable addressable market, or the market that we believe our device addresses most concretely, of $400 million. However, if we expand the scope of our device to include various bone drilling fields in which our device may apply, such as orthopedics, spinal, and ENT, we obtain 800,000 procedures annually in the US and a total addressable market of $800 million.
Our device DeciBone reduces the amplitude of the drill-produced wave, but also incorporates seamlessly into current technologies used during cranial drilling, minimizes the surgeon's visual and physical obstruction of the operational space, and adapts to individual patients' anatomies. The hallmarks of our design include an in-ear accelerometer in blue, connected through internal wiring to a microcontroller in yellow, and a transducer on the temporal bone in green. First, the drill produces a vibration measured by a downstream sensor. Once this signal is received, a counter vibration is produced by the transducer that is opposite or out of phase of the drill-produced wave, as shown in blue. And while there are 2 waves total of different origins, these vibrations sum to produce a resultant wave of 0 amplitude and completely reduced intensity.
Now I'll discuss our testing and prototyping process. We simulated drilling with the transducer producing vibrations, an accelerometer to detect the vibration, and another transducer to produce the counter vibrations. We looked at 3 conditions observed by using an oscilloscope: the drill and device out of phase to cancel the resultant wave, and in phase to increase the resultant wave intensity, and our device off as a control. We recorded data on a flat surface and on a skull replica at 3/4 of an inch and 2 inches from the sensor. First, we tested the concept on a flat surface where the devices and the sensor are separated by 0.75 inches, and we were able to get a 48% reduction in vibration magnitude. This reduction shows that we were able to successfully reduce the vibration intensity of a given wave by producing another wave to counter it. Next, we repeated the test with a 2-inch separation. We were also able to observe a reduction here, but this time the reduction was only 13%. Finally, we tested on a skull replica at 0.75 inches, and we achieved a 12% reduction. This reduction was still significant, but not as drastic as the tests on a flat surface. The variability in the wave propagation with different distances and geometries further motivates a control loop.
For our next test, we wanted to test the ability of our device to measure the frequency of an incoming vibration using only portable components. Frequency measurements were shown to be approximately 95% accurate. Together, the amplitude reduction and frequency prediction can be combined to produce a tuned counter vibration, and this is achieved using proportional integral derivative or PID control. Put simply, this device assesses the efficacy of the cancellation and can make adjustments as these amplitudes and frequencies change during the drilling process, resulting in a dynamic cancellation system. What makes our device so novel is that there is no current medical devices available that addresses bone-conducted sound in a surgical drilling setting. In this way, while commercial listening devices are able to actively cancel low frequencies with combined air and bone-conducted inputs and outputs, no other device is designed to specifically receive bone-conducting signals in the ear canal and then cancel these signals, also using bone conduction on the temporal bone in a non-invasive manner. The potential impact on the patients in hospitals is massive, as the average inpatient care cost per day is around $2,883. Because we're aiming to address the comfort levels in 400,000 awake brain surgery patients annually, and because these patients become discharged one day earlier than patients under general anesthesia, the possible cost saving is upwards of $1.15 billion annually.
Our next steps in prototyping would be to validate the control of the transducer sensor system as a whole. After validating each component separately, test a prototype with a drill on a cadaver head rather than with the transducer on a simulated skull, and then develop a simulation console to characterize the vibrations due to the drill device. In terms of marketing, we expect our device to be classified as a Class 2 device as it is utilized in a sterile surgical setting, yet is non-invasive to the patient, and the regulatory approval process will likely be de novo as active noise cancellation technology has been proven and patented prior, just not in the cranial drilling space. Thank you, and welcome to a world of patient-centered care.